Thank you for the invitation to talk to you. I'm sorry that I've missed most of the day, but it actually was the annual general meeting of my company, and it was felt that I should be there. The Career Force is an industry training organisation, and it is responsible for 9 sectors of the economy: the health sector, the social services sector, the cleaning sector, and the urban pest management sector, of all places. The part that you're most interested in is probably the 56,000 paid care workers who are currently supporting vulnerable people in the areas of mental health and addiction, home care, aged residential care, disability care. And this is the great untapped resource of the New Zealand health system. They have just had a huge pay bump that comes into effect on the 1st of July. And suddenly this workforce has career paths in front of them and the opportunity for people to actually make a career out of the caring professions. So the Financial Times last week said that technology is the tool to spur a healthcare revolution. Well, if we were talking earlier this afternoon about market forces, the truth is that as labour becomes more expensive, productivity becomes more of an issue. And providing that workforce with the technology enablers to lift their productivity is a huge and present opportunity. The idea of my generation is that we be allowed to age in place. That is, that instead of going off into an institution for our final years, that we're allowed to live out our lives at home, and that in order to do that, we are going to need to have educated and trained patients supported by people who have a whole range of competencies. And those competencies are what are contained in the qualifications that Career Force is responsible for. So basically, what we've discovered is that if we take these minimum wage workers, who are mostly women, and ask them to tell you who amongst the people they care for is most likely to be in hospital in the next 2 weeks, they'll be able to tell you with 80% accuracy. Now, they mightn't have the clinical language to describe it, but they'd say, Ray's starting to get a bit bumbly. He's starting to walk into things. He's not quite himself. He's a bit poorly. Now, of course, this workforce isn't part of the integrated care workforce yet. We're moving in that direction. So when somebody's discharged from hospital, they are likely to be discharged not to the GP's practice, but to their home and to a carer. I managed a secondary hospital for some years, and 50% of our admissions were over 65, and of those admissions, 30% were there for medication issues. In other words, the patients weren't taking the medicine that was prescribed for them. And when I talked to some of those patients in my hospital and said, you know, how are things going? What are you planning to do when you get home? They would reveal things like, I'm not starting the new medicine until I've finished the old stuff. So there's a whole generation of waste not, want not. And of course, they need to be supported. In fact, when you're very unwell, even if you're quite bright and not tortured by self-doubt, it's amazing how much you need an advocate to explain what the treatment process is going to be. So the workforce that is providing this care to thousands of New Zealanders every day is inelegantly and pejoratively described as the unregulated health workforce. We searched the world to see if there was a better word for that, and we found that our first people, in fact, had a much better word for that, which is kaiawhina. And the kaiawhina workforce is the carer workforce. Now, this workforce hasn't been engaged in workforce planning up until now, and we have produced, with the consultation for the large number of stakeholders and the ministries, a 5-year workforce development plan and a 20-year forecast. And a key part of that is to integrate those carers into the primary care system and the secondary care system. In order for that to happen, they need technological enablers, and they need to have handheld devices which enable them to record their observations, which enable them to monitor remotely and help the clinicians monitor remotely those of these people who are not capable of doing it for themselves. And there will always be a large proportion of people who are ageing in place who will need help from a carer in order to stay safe and healthy at home. So there's a revolution coming, and of course necessity will be the parent of change. The increasing cost of the kaiwhina workforce will make it much more worthwhile to increase their productivity. And the productivity enablers that they need are really to connect them into an integrated care system. What we're trying to do is to make sure that people have minimum standards of qualification. And in that process, we apply a process called REAL. So there's lots of workers out there who've been doing their job for years and years and years. And they have competencies, but nobody's sure if they're qualified. And the process that we use is to sit down with them and look for evidence of competence, and then only ask them to fill the gaps that exist. So what we're finding is that the workers have generally got about 50% of the competencies required of the qualification. So respecting that knowledge, we can then come up with efficient ways of providing training and learning and assessment.